Some of the most commonly diagnosed eye conditions include age-related macular degeneration, diabetic macular edema, and retinal vein occlusion. Diabetic macular edema can be very like wet AMD. Retinal vein occlusions are blockages in a vein in the eye and can also lead to symptoms similar to AMD. For those living with these conditions, there are a variety of forms of help available and practical steps you can take to protect your vision as much as possible. These include following good general health advice, following a healthy, balanced diet, trying to keep your weight and blood pressure at healthy levels, and not smoking. The most important thing that you can do is regularly check and assess your vision to see whether you notice any deterioration in your eyesight. Injections into the eye are typically required for the treatment of wet AMD, diabetic macular edema, and retinal vein occlusion. Rest assured that it is a very simple process and is done after the eye has been numbed with anaesthetic. The injection is performed in the corner of the eye, and most patients don't even see the needle, only feeling a light pressure against the eye when injected. In some rare instances, a few people experience allergic reactions to the iodine used to clean the eye before these injections take place, although this is rare. The solution used may also cause irritation to the eye or skin, but if you experience discomfort, you should inform your specialist. Your ophthalmologist or specialist may change the anaesthetic, saline or lubricant drops used. If these don't improve the reaction experience, there are other options available, and your specialist should talk you through those options and what the effectiveness and potential risks involved might be. You're probably wondering what to expect with having an injection into the eye. The injection itself is painless, with most patients only feeling a light pressure against the eye. The patient usually lies on a couch while the eye is held open and anaesthetic drops are used to numb the eye. The patient then looks to one side and is injected in the opposite corner of the eye. This takes just a few seconds. Once the anaesthetic wears off, there may be some discomfort experienced, but this is mild and often patients don't experience any pain at all. Try not to rub the eye following the injection, as this could cause damage to the eye without you knowing it, since the eye may still be relatively numb. For those that experience severe discomfort, call your specialist or return to the hospital immediately to ensure that you receive treatment for the pain and make sure that you allow the eye to heal properly. If you experience pain 24 hours or more after your injection, take immediate action, particularly if you experience redness and vision reduction, which may mean that you have an infection inside the eye. Remember to ask your eye specialist to provide you with your treatment program and schedule, and make sure that you do not miss any necessary treatments. Treatment generally begins with 3 injections a month apart, after which your doctor will assess your condition and decide how frequently you need further treatment. Some activities should be avoided for at least a week after the injection. You may feel overwhelmed or anxious at the moment, particularly about the potential treatments by means of injection, but you'll find a wealth of information available on the treatment of AMD on the Macular Society website. You can also speak to an injection buddy who has experienced the injection themselves by calling our advice and information service. Visit our YouTube channel for more helpful and practical information on living with AMD, as well as general eye health. You can also join the Macular Society for regular updates on research into AMD, new therapies that become available, and information on how to live well while managing AMD.